Hello everyone, my name is Binay. Welcome to my channel LifeLearn. Today we are going to discuss about leukemia or the blood cancer. So what is leukemia? It's the cancer in blood cells. So what are the blood cells present in your blood? We know that two kinds of blood cells, RBC and WBC. So leukemia is the cancer in WBC, or you can say leukocyte. WBC or leukocyte. In my previous video, I have told about what are the blood cells present in our blood, what kind of blood cells and where they are present, and how hematopoiesis, how the blood cells are formed, that also I have discussed in my previous videos. So now we will see where leukemia starts from. Previously I have discussed that blood cells starts from forming from bone marrow. Suppose this is the bone marrow, and the formation of blood starts from here. There are so many stem cells present in the bone marrow, and when needed they start differentiating and they form different kinds of cells of blood. So what are the different kinds of cells? Myeloid and lymphoid. In our blood there is a particular number of cells from each group. That means myeloid and lymphoid have a particular number of cells. In our blood, number of leukocytes or WBC is around 4,000 to 11,000 per microliter. So when the leukemia happens, this cell number highly increased. There will be so many leukocytes in our blood. So usually what happens, these stem cells are strictly controlled. The growth of these cells are very strictly, and all the signaling process are very strictly controlled. So whenever they get signal from outside, they will start growing and differentiating. But sometimes what happens, suppose this is one stem cell and it is dormant, it is not growing and it is present in the bone marrow. So we are taking one blood stem cell. So when it gets signal from outside, suppose this is some kind of signal, some cytokines or something, some signals, then only it will get the signal on its receptor. So this is the receptor. Then only it will divide either to myeloid or lymphoid. And it has a nucleus. Sometimes what happens, there are some mutations in its chromosome or in some of the gene. So in that case, it doesn't need any signal to grow. So it automatically either it grows to myeloid or lymphoid, and it starts growing unlimited. So this will increase the number of leukocytes. Previously what I discussed, that there are some stages of differentiation. So the first cell is hematopoietic stem cell. hematopoietic stem cell differentiates into common myeloid progenitor or common lymphoid progenitor. So from this there are different stages, and it goes some stages, and finally it reaches to the mature cell. Similarly, this also there are some stages, and then it reaches to mature cell. Mutation starts either from here in any stage. So depending on the cell type, there are several types of leukemia. So if this happens to myeloid, this will called myeloid leukemia or lymphoid leukemia. And if the leukemia happens early stage cells are very highly dividing cells. So they will grow very fast, and there will be no controlled growth. So if early stage, that will be acute, either acute myeloid leukemia or acute lymphoid leukemia. If that happens in the later stage, those cells are little mature, and they will grow very less. So that in those kind of cells, those kind of leukemia is called chronic, either chronic myeloid leukemia or chronic lymphoid leukemia. So these are the basic differences, different kind of leukemia. So, and then also there are several other kind of leukemia based on different type of cells and different type of mutations. They are divided into different kinds. So we are not going to in detail on that. If you need details about the differences or different kinds of leukemias, I can make another video for that. So when the types comes, there is a common confusion that between leukemia and lymphoma. Lymphoma is different. Leukemia happens to bone marrow cells, and lymphoma also happens to bone marrow cells, but they are moved, some of the cells they move to some lymphoid organs like spleen or other lymphoid organs, and they start growing in mass in those cells. So look, that is the basic difference. And some people say that leukemia happens to myeloid, lymphoma happens to lymphoid. That's not true. Leukemia can happen to either myeloid or lymphoid. So that is the basic difference between leukemia and lymphoma. Leukemia is present all over the body, and it can present, it starts from bone marrow, and it moves to different parts of the body and also in the peripheral blood. But lymphoma is localized. Lymphoma is localized to particular lymphoid organs or lymphoid tissues. Next is what are the symptoms of this disease? As I said, these cells, immature cells, grow very fast. Because of the growing of these cells, other cells, mature cells are reduced. Because of that, you can see in some cases there will be less number of erythrocytes, so there will be anemia, because these cells will populate in periphery and in bone marrow, so this will decrease the erythrocytes. So this will increase anemia, and because of anemia, other tissue, other cells or our muscle cells cannot get enough oxygen or enough energy. That will increase the weakness. Similarly, this will decrease the platelet. Because of the decrease in platelet, there will be some bleeding in your tissue, like in gum or in muscle or under the skin. You can see some bruises and some blood clot or bleeding. So increase in bleeding. Also, these cells are immature cells. They cannot help in gaining immunity. What is the basic function of leukocyte? they help in immunity, because these cells are increasing, there will be no mature cells, so we are very much prone to infection. So you will get frequent infection. And next is weight loss. These cells need so much energy, they will take up all the energy, and other tissue will not get enough energy, so there will be weight loss. Because these cells are growing in bone marrow, they will cause some bone pain and also some fever. So these are the basic symptoms of leukemia. Next is diagnosis. How to diagnose this disease? When you see these symptoms, when you go to the doctor, doctor will check first the symptoms, and then a doctor may check some lymph tissues or some bleeding on skin or gum, and then a doctor will prescribe the CBC, complete blood count. From complete blood count, if it is found that the number of leukocytes are highly increased, more than 11,000, so there is a chance that there will be leukemia. Next comes, so this is from CBC. Next comes blood test or checking under microscopy. From microscopy, usually what happens, these are called, these immature cells are called blast cells. So in microscopy, when the leukemia happens, you will see high number of blast cells. So usually the blast cells increase more than 20%. So this is the condition for leukemia. So microscopy can be done for peripheral blood, or it can be taken some biopsy from our bone marrow, just little puncture and take some cells from bone marrow. In both the cases, if the blast cells are increasing more than 20%, this is another test that this may be leukemia. Next comes when you get that these are the leukemic cells or leukemia, the blast cells are increasing, so it must be the leukemia. And next comes the staging. Staging comes when we get to know that where are these leukemic cells are present. These leukemic cells either move to our spinal cord, central nervous system, if they have moved to central nervous system, or to liver. So they usually doctor prescribes some liver test, liver function test, or to kidney, or some lymphoid organs. So in those cases, either doctor will prescribe to check similarly the biopsy from CNS, or liver function test, kidney function test, or lymphoid organ test. Also they can prescribe to check CT scan, MRI, to confirm these functions. After doing CT scan and or MRI, they can make the stages. According to the stage, they can start the treatment. Another most important thing for the testing is checking the karyotype of these cells, because in most cases what happens, the chromosomal mutation happens. In those cases, after karyotyping, they can find out what kind of mutations are present in chromosomes. That is very much important for targeted therapy. So next is treatment. When it is confirmed that this is the leukemia, first thing they start with chemotherapy or induction therapy. Usually for leukemia treatment, there are some stages of treatment. First one is induction. Second, in induction therapy, they try to reduce as much as blast cells from periphery or in bone marrow. Second one is consolidation. In consolidation therapy, this therapy is particularly for targeted therapy. So, after finding out what kind of mutations are present in those leukemic cells, they will start targeted therapy. And third one is maintenance therapy. So, after reducing maximum cells from bone marrow or peripheral blood, there will be the maintenance therapy, so that it will not come back. So this goes on like 1 to 2 years. So this happens around 6 months, and this is the chemotherapy regimen. So now we'll discuss what are the options for therapy. The first one is chemotherapy. In the chemotherapy, it is tried to reduce as much as blast cells from our body. Second one is radiation therapy. Similar to chemotherapy, this is also done at induction stage. So radiation is also done to reduce maximum number of blast cells. And the third one is targeted therapy. What happens in this stage? Suppose this is a blast cell. In this stage, they first identify what kind of mutations are present in the cell. Suppose this is the nucleus, and either from karyotyping or genome sequencing, they find out what kind of mutations are present. Based on that, there will be either receptors or some signaling molecules which help growing the cells. So if this is, suppose there is a receptor here which is helping growing of these cells. So in each type of leukemia, there will be a different kind of mutation, and there will be different kind of the molecule or signaling molecule which helps the leukemia to grow. There are several molecules which are targeted to block these receptors. So this helps in reduction of undetected or undetected cells in our blood or in our bone marrow. Before doing this, it is important to know which kind of mutations are present in those cells. Next is immunotherapy. This type of treatment depends on either antibody or some targeting our immune system. In this type of therapy, what they do, they use some antibodies to target these kind of receptors and block them. Blocking them will inhibit their function, and these cells will be dead. Another concept which is very fast developing is antibody-drug conjugation. What happens in that case? Usually what happens in blast cell or leukemic cells, as I said, there will be some receptors present on cell membrane. So this is the blast cell, we name it B, and there will be another cell in our body which is a normal cell. This is the normal cell, and in this case there will be no receptor which is present on leukemic cells. Then identifying this receptor which is present only on leukemic cell and not present in our normal cell is very much important. After the identification, they produce antibodies against the receptor. And by the way, I work on this. This is my field of research. Immunotherapy and antibody-drug conjugation is my field of research. What they do is they develop some antibodies against the receptor, and after finding out particular antibody which can be targeted these kind of receptors, they conjugate those antibodies with chemotherapy drug. The concept here is after getting signal from outside, they get internalized. They move inside. There will be inside out like this. They go inside. So this is the concept which is important for immunotherapy or antibody-drug conjugated therapy. Then what they do after finding out the antibody, suppose this is the antibody, they conjugate some chemotherapy drug to this antibody. Suppose we are conjugating these drugs here. In chemotherapy, what happens? This is not targeted. In chemotherapy, they inject some chemotherapy drug to patient, and this acts on all over the body, on all the cells, whether it is normal or leukemic cells. But in antibody-drug conjugation or immunotherapy, what we do is we conjugate these antibodies with chemotherapy drug, and because these receptors which are targeted are not present in normal cells are not affected, and this antibody will go and bind to these receptors. And as I said, after getting ligand, these receptors internalize, and after internalization, along with the antibody, it will go inside. So here the antibody is present, and these antibodies are conjugated with these drugs, and after getting inside, this will be released inside the cell, and this drug will go and inhibit the growth of these cells. So this is very much effective. First important thing is identifying the receptor, and then identifying the antibody and conjugating the proper drug to antibody. These are the steps for antibody-drug conjugation therapy, ADC. And this field is very fast growing. There are already some drugs available in the market for this treatment. Suppose they are targeted for CD33, CD19. These kind of drugs are already present in the market. CD19 is targeted for lymphocytic leukemia, and this is for myeloid leukemia. And next treatment method is CAR T cell, chimeric antigen receptor T cell. What happens in case of cancer? Because these are self cells, our immune system cannot detect these abnormal cells. So in this technique, what we do is, like I said earlier, that some receptors are present only on leukemic cells, which are not present on normal cells. So in this procedure, we take out T cells from the patient. Suppose this is the patient. First, what we do is take out the T cell from their body, and these T cells are engineered. So these T cells are engineered with a particular antibody or receptor which can detect these receptors. So after engineering, these T cells are grown in number, and then they injected back in the patient, and these T cells will detect these leukemic cells, and after detecting, they will kill these leukemic cells. So this is the basic principle of CAR T cell. This field is also very important. This is highly effective also, and this field is also growing very fast. And another option for this treatment is, because there are several drugs or several trials are going on, the option will be the clinical trials. So you can ask your doctor whether there are some clinical trials going on against the leukemia. So based on that, you can get some clinical trial, or you can volunteer for clinical trials for the treatment. Another treatment option is stem cell transplantation. Because this leukemia happens to the stem cells of blood stem cells, so usually doctors keep this option for the last, because this is little difficult and also very tricky and little risky also. What they do is they remove maximum stem cell either by radiation or by chemotherapy. Either they take out some stem cells from the same patient, they grow these stem cells, and then they put it, after removing or destroying the stem cells, they put it back these cells into the patient. Or in some cases they find out some donors which have similar typing, HLA typing, and then they isolate these stem cells from those donors. They grow these stem cells, and then they put it to the patients. So in this process there are some critical stages. If they are taking stem cells from donors, there are chances that there will be some rejection. For reducing rejection, there are also some drugs or treatments to decrease the rejection. This can be overcome using those drugs. And another difficulty is, because we are removing and reducing all the stem cells or all the blood cells, there are chances of getting infection frequently, because after transferring these stem cells to the patient, it takes for growing and repopulating the bone marrow, it takes around 6 weeks, 2 to 6 weeks. So in that period there is a chance, because there is no leukocyte or immune cells, there is a high chance that you get infection, and also there is a chance that you get bleeding disorders, because there is no platelet. So these are the problems related to stem cell transplantation. What are the causes of this disease? First one is smoking. This is very dangerous thing. Smoking can get some chemicals which can cause the mutation in bone marrow. Next is some viral infections, because viral infections cause chromosomal integration. So that is why viral infection is also very dangerous, and it can sometimes lead to leukemia. Another one is therapy related. If you have taken some radiation therapy or chemotherapy, that also sometimes leads to the blood cancer. And some of the genetic disorder like Down syndrome, and another one is some other chemicals, exposure to other chemicals other than smoking. There are also some chemicals which can be exposed to chromosomes, and they cause mutation. So these are the causes of leukemia. So that is the basic concept about leukemia. So if you have any question or doubts, you can write those in the comment section. And if you need some more concept or more description about leukemia, please write those in comment section. I will make another video. Thank you for watching my video. Bye bye. See you next.